Well, Larry, just to give you an idea of how fentanyl has created this crisis on San Francisco streets, fentanyl first entered the drug scene here in 2018. Now, 2 years later, in 2020, during the pandemic, San Francisco lost 725 people due to overdoses. That was more than all the people who died of COVID in this city that year. Now, despite all the resources, despite throwing everything at it, city officials are saying it could be worse this year. The number of deaths so far this year due to accidental overdoses in San Francisco prompted the health department to call for an emergency press conference.
80% of the deaths to date in 2023, overdose deaths, are now caused by fentanyl.
So far this year, 473 people have died of accidental overdoses, 385 of them due to fentanyl. That number could surpass 800 deaths for the entire year.
It pains me to share that this is the highest overdose deaths San Francisco has experienced.
Why is San Francisco seeing more deaths due to fentanyl? When it was first introduced, people were mixing it with other drugs. But now, according to a spokesperson for the health department, more drug users are opting for fentanyl alone.
Fentanyl has become cheaper, more potent, and more available.
According to the health department, they are currently treating 25,000 people with substance and mental health issues, and now expanding services and outreach, not to mention the distribution of more Narcan. Brett Rubin is a counselor who for years was addicted to heroin.
We don't give up on anyone. If people say, no thank you, go away, we don't want your help today, we say, how about a different day?
But as a matter of practicality, many more could die while waiting to decide if they are ready for treatment.
What kind of life is this? Exposed to the elements all the time, trying to get by to your next fix, your next piece of life? You have poop on the ground.
Jim Rao is with Families Against Fentanyl. He had not been to San Francisco in several years, so we invited him to walk with us. He lost his son Tom to fentanyl and today was speaking to the American Chemical Society about the proliferation of the synthetic drug.
This material can be dispersed in the air, food, or water in the most rudimentary ways, and this needs to be stopped before it brings down our country from the inside.
Now, some people try to compare this to the crack cocaine epidemic of the 1980s because it devastated so many communities, especially the African American community. And yes, fentanyl is doing that. But there's a difference here. In the 80s, there were a variety of risk factors that, contributing to the epidemic. There was the drug, crack cocaine, but also the crime associated with the addiction, such as homicides, and also the possibility of contracting AIDS. Now, fentanyl, the drug itself, is that much more lethal. In the newsroom, Leanne Melendez, ABC 7 News.
Leanne, thank you. If you or someone you know is struggling with drug addiction, you can find a list of local resources on our website, abc7news.com/takeaction.